Welcome to The Learning Curve. The learning curve is not meant to take the place of meaningful interaction between you and the healthcare provider of your choice. If you have a health problem that needs attention from a health professional, we urge you to seek individualized care from your healthcare provider and to do so in a timely manner, whether such care is with a chiropractic physician or other medical professional, and follow that healthcare professional's advice specific to your personal needs.
Hi, I'm Dr. Brad Shapiro, and thank you again for watching us in another week of The Learning Curve. With me again, I've got Dr. Jerry Anderson.
Yes,
and
I'm back.
We're glad to have you, and we're just looking forward to covering some more exciting things. One of the things that we wanted to cover today was, the idea of some of the things we do involving kids, and I know this is something that rings a personal tone for you because of some of the things you dealt with as a kid.
Yeah,
so
well, I was one sick kid last week, let me tell you, and this is why it's important to know this. The pediatrician who is trying to be responsible is going to advise parents to not give their children an antibiotic under the age of 3 unless it's a life-threatening emergency. Now, I'm one of those kids that got antibiotics from infancy on multiple times. It screws up the person's immune system for life. It's that serious. And in contrast, if you look at the healthiest kids in America across the board, it's children that grow up on farms, the farm kids, because, well, let's face it, they're exposed to all sorts of pathogens. Well, I used to think, well, this must be the fresh air and the exercise. Well, yeah, but the fact that the children are exposed to pathogens that develop their immune systems gives them lifelong better immunity. And that's what you want to do. And so instead of giving me antibiotics when I was a year old or less, or at age 2 or whatever, they should have gotten me off the cow's milk that I am allergic to. That would have helped a heck of a lot and would not have made the antibiotics anywhere near necessary. And Dr. Shapiro, where were you when I really needed you? I mean, look, could it be that I'm 61 and you're 33? Is that your excuse? Or
well, I hope not being born yet would be a good excuse, but
yeah,
that's about all I can come up with.
But anyways, to try to make a serious point here, if any of our viewers have children that are sick, grandchildren that are sick, please look toward a holistic solution instead of automatically putting the child on antibiotics, even for ear infections and that sort of thing, which chiropractic has done some marvelous work with correcting. And I'm talking about, and I know we're opening ourselves up to criticism when this happens because people getting a chiropractic adjustment for their child instead of antibiotics for the ear infections. Well, they could have permanent ear damage, and all that. Well, how about this? How about if the kid that you're seeing has been not through 1, not 2, not 3, but maybe 4 rounds of antibiotics that have absolutely failed to correct the problem, and you adjust the child, the neurological imbalance is corrected, the lymphatic flow is improved in the sinus area, and all of a sudden the child is healthy, the ear infection's gone. Now, what? You understand my frustration, I think, in
Sure.
talking about this. It is so frustrating to have seen this for 26 years. These kind of things happen. And yet still, there's some question as to, well, should a child get a chiropractic adjustment? For heaven's sakes, the activator technique, the light force, the little thumb pushing, that you do to adjust an infant, for heaven's sakes, the children are exposed to so much more noxious and worse stuff in their young lives. It's ridiculous. So.
Yeah, and it's one thing it makes me think of too is there's a lot of forums that are coming up on things like Facebook and some of these other things where mothers are realizing that their kids are going through these cycles. They do the 1, 2, 3, 4 rounds of antibiotics. Things clear up for a short period of time, but then they need another round of antibiotics. And like you're saying, that's a real common scenario of just this merry-go-round of kid gets an ear infection, or they get some sort of infection, they get on an antibiotic, it gets a little bit better for a short period of time, then in several weeks or months they're back on the antibiotic. And that's the kind of cycle you're talking about, avoiding, keeping kids from having to take all these drugs, especially when it's not necessary.
Well, one of my nieces came down with recurrent fever, and she had been to the family doctor and it had, I think, 2 or 3 rounds of antibiotics. Well, the infection would come right back. Well, I did some of the reflex work that I do, or did, when I was really active at the practice, doing applied kinesiology. And the girl had a problem with the ileocecal valve. That's a thing that we find pretty commonly. And correcting that corrected the problem immediately. And, well, everybody was kind of astounded. Even I was astounded. She responded beautifully. But this is the kind of thing that needs to happen.
Mm-hmm. Sure. It's
at least more often than it does.
Well, it's, and you can do it more naturally, you can do it in a safer way than having to take the drugs. We're both of the opinion when drugs are necessary, thank God for them.
Sure.
But if you can avoid these things that are synthetic and they're not natural.
And it was good to have a really good medical doctor had vetted the problem. It was not something that was a life-threatening, it was just extremely irritating. It was interfering major with the kids' ability to function, stay in school and so on.
Sure.
And so the fact that I was able to do something that the mainstream medical doctor was not able to accomplish in this case, of course I guess I feel kind of a perverted thrill when that happens. I don't mean to be a big ego, but it's just kind of nice to know that some of the stuff that you have in your armamentarium really works, and it works very well in a lot of cases. And so mainstream healthcare really needs to take notice of this, and they either need to get us into the mainstream healthcare arena in a meaningful way, or steal what we do or something. Of course, whatever.
Sure. And it's, you brought up the point that this was something that your MD doesn't do. And so it's, again, we just kind of go back to the basics. If you've got this huge umbrella called healthcare, within that, you've got different types of doctors, chiropractors, medical doctors, natural medicine doctors, Chinese medicine doctors, acupuncturists, all kinds of stuff. And the key thing to understand is the fact that, we don't do everything the MDs do, but by the same token, they don't do everything that we do. And so, why not mix and match these things for the patient's benefit?
I'm doing something the MDs don't do either. I'm going to be Pharaoh. Yes. What I'm holding up here is a little, one of the publicity devices for the Joseph and the Amazing Technicolor Dreamcoat program I'm going to be doing. We may show a slide on this a little bit later, but anyway, this is why, I had to tell you this is why the sideburns and the longer hair. I'm Pharaoh in this production, and I've got to let it grow. And
I thought you just decided to go buck wild ever since you went retirement.
Yeah, since I've sort of gone in retirement, he's having that midlife or twilight crisis or something. We don't know what's wrong with the guy. He's letting his sideburns grow out. He looks really weird.
Dreadlocks are next, right?
No dreadlocks, man. No. But anyway, that's the reason for the strange grungy look there,
Sure.
But anyway, I thought I'd mention that. Incidentally, the times, I tell you this too. Our production is going to be the last 2 weekends in April. Now the high school is also doing this same production. I strongly recommend that you see both of these productions because the kids are going to do their own variety of this, and I think they'll do a fine job too. The cast that is in the production at Tullahoma, these folks are great. It's going to be a wonderful time. But anyway, just thought I'd mention that.
No, it's exciting stuff, and we appreciate you guys staying tuned with us. Again, I'm Dr. Brad Shapiro with Ultimate Health Chiropractic. With me, Dr. Jerry Anderson, and please stay tuned while we discuss some more exciting healthcare topics. Hi, I'm Dr. Brad Shapiro with Ultimate Health Chiropractic, formerly known as Anderson Chiropractic. I've got Dr. Jerry Anderson here with me, and thanks for tuning in with us, and we'd like to discuss some more exciting topics with you. One thing we want to dive into now is some of the differences between different healthcare providers. You've got medical doctors, you've got doctors of chiropractic, you've got physical therapists, you've got acupuncturists, you've got all these different types of doctors. But one thing we want to touch on is just some of the differences between a physical therapist and a doctor of chiropractic.
Well, you know, Dr. Brad, we also want to remind people, like we do at the outset, our little disclaimer: if you need health care, we don't want you depending on a program like this to give you what you think is health care advice for you. Go to your healthcare provider, your doctor of chiropractic, your medical doctor, osteopathic physician, nurse practitioner, whatever, or physical therapist for that matter, to get care that is tailored to your specific needs. But we want to raise the consciousness of people on issues like this. And you're talking about DC versus PT. In other words, what is the difference between the chiropractor and the physical therapist? Well, many years ago, when I first came to practice in Winchester, I contacted the physical therapy outfit at the hospital. I mean, this is 26 years ago.
Oh, wow.
Introduced myself and said, hey, look, I'm a chiropractor, and I just thought it would be fun to get together and maybe discuss the situation a little bit, our different viewpoints on physical medicine and so on. And I was not well received. The guy was very curt, very unfriendly, and I thought, well, gosh, I guess, you know, there's something wrong here. I don't know what it is. But anyway, a very good medical doctor, Dr. Dudley Fort, an internist who actually helped me get started in my own practice around this time. I asked Dr. Ford about this. I said, Doc, what is going on? I would think that because we do a similar type thing, in that at least this far, we're doing physical type treatment to try to accomplish our goals. I would think that we would have some common ground there. I said, what's going on? And he said, well, Jerry, they think they're better than you.
Wow.
I said, what? I said, wait a minute. Chiropractic education meets or exceeds minimum medical school requirements. We've got the same or more training than a medical doctor, except for the hospital residency, which we don't have because we've been kept out of the hospitals. So how do they figure they're better than we are? Well, I don't know. That's the way they're taught.
Sure.
They are taught that they are better than you are, that you all are stupid quacks, and you really don't know what you're doing, and you might as well just stay away from these guys, this sort of thing.
Even though the facts don't support that.
Exactly. And around that time, Channel 4 in Nashville did an incredible analysis on chiropractic versus mainstream medical profession. And it bears out, it documents what I'm talking about. The reason they did that was because the question of allowing chiropractors to be on the staff in hospitals, in other words, eliminate the law that strictly prohibited chiropractors from being able to be on staff in hospitals. This came up for testimony before the state, and that's the reason for the issue at all. But anyway, the physical therapy community does some fine work, and thank God for them.
Sure.
It's got some great people in that. And it's not their fault. But as recently as, I guess, 4 years ago, a physical therapy assistant told me, oh yeah, they still are basically teaching that you chiropractors, you don't know what you're doing, that we're the real thing, physical therapy is the real. Look, let's get real. Let's have a little bit of respect for all the different disciplines and the good that we can do. And it also is kind of astounding to note, but for people who don't think we're very good, why do they want to do what we do? Why have they made 3 separate attempts, I think it is, in Tennessee during my practice life, to claim the right to do spinal adjusting? And how do they do it? Well, they're going to go to a weekend course for a couple of times, and they're going to know how to manipulate to adjust. Folks, get real. That's incredibly dumb.
It's insane and dangerous.
It is. And so, look, we only ask them to do this. For the sake of humanity, we're willing to say this. Go ahead and steal chiropractic. If you're going to steal, though, steal it right. Don't just steal the part that handles pain syndromes better than anything you've got in your armamentarium. Steal the part that helps people get well and stay well without drugs.
Sure.
So,
one of the things that really made a big difference for me in terms of understanding this, because I think we all have, every healthcare provider, we all have this sense of, gee, I wonder how I measure up to other doctors. The chiropractor wants to know, gee, I wonder how my skill level measures up to an MD, or vice versa, or with natural medicine or acupuncture, whatever the case may be. But one of the best experiences I had is I got to work in a multidisciplinary clinic in Chattanooga. And so I really got to see firsthand how the chiropractor compares to the medical doctor. We were all in the same room. We were sharing some of the same patients, and you really get to see, you know, just what's this really look like in real life circumstances. And a well-trained chiropractor, we not only measure up, but we really, really hold our own. And it really gave me an indication of the fact that, yeah, there are some things that I don't know as well as they do, especially concerning drugs. But there's also a heck of a lot of things that they don't know that we're well trained in, that we really understand.
I can't wait to tell you this. One of the guys, he was an upperclassman when I started at Logan College of Chiropractic in St. Louis, Dr. Glenn Manceau, the Raging Cajun Glenn Manceau. He's a doctor of chiropractic. He is also a licensed physical therapist. He conducted a seminar in Huntsville, Alabama a few years ago that I attended, and it was great to see Glenn again. But he said, and this is quoting his overall statement, I guess, his overall philosophy on the subject. He respects the physical therapy community for what it does, but he said, guys, you know, a lot of the medical doctors still are not referring patients to you, and you know, you kind of feel like they should. And he said, I know you got to have deep down a feeling, well, wait a minute. The physical therapists, they know something we don't know. Are they doing something we don't know how to do? What's going on here? Why do the medical doctors just persist in this refusal to refer to us, but they pretty routinely refer to physical therapists? What's going on? And he said, let me put this idea to rest for you. He said, the physical therapists, you chiropractors do things they can only dream of doing. They can only dream of doing. Well, that settled the issue for me right there. I loved hearing that. But anyway, Dr. Manceau has done professional testimonial. Well, what's the term? Medical legal issues. He has
Sure.
Testified as an expert witness for the chiropractic profession on many occasions, reiterating the point that we're just talking about there. And so, does that mean that we don't need physical therapists? It does not mean that. We do need physical therapists, thank goodness for them. But, look, let's get it straight about chiropractic. How about that?
Sure. Versus, you know, the campaign, like you always like to quote, the campaign to eliminate, contain, and destroy.
Absolutely, which Dr. Mercola, the internet doctor, recently brought up in resounding fashion, talking about it. He said, we thought the behavior would change toward chiropractors. It didn't. It just went underground. And he said insurance companies still discriminate. And one of the areas we were talking about on our radio program this morning had to do with the payment for EMS, electronic medical stimulation, electronic muscle stimulation, excuse me, to the body when we're trying to accomplish that. You might want to mention that again.
Sure. And one of the things he's actually referring to something called, like he said, electric muscle stimulation. EMS. We call it E-stim for short. But it's a great example of something where when a chiropractor does this procedure, our bill rate is one amount, which is much less than a physical therapist, I might add. But when we bill this, we get less money than if a physical therapist performs the exact same procedure that we do. They get paid more. And to kind of give you the big picture of all this stuff, you got to remember that we have doctorates, they don't. We had to spend a whole lot more time and money to get our education than they did. So we had to spend more time and money to get our education, but yet to perform the exact same procedure they perform, we receive less money. Well, it's not reasonable.
There's another facet to it, Dr. Shapiro, and here it is. Chiropractors also do something that is sort of synergistic. We use the EMS not just as a means to an end itself. In other words, well, we'll put this on here and this will fix the problem. No. We use that to help relax muscles, in addition to other things, but to relax muscles before an adjustment or to assist the process so that the patient gets a much more effective spinal adjustment.
Sure.
Makes it more clinically effective and therefore more cost effective. And so to see the disparity, well, it's really unfair. I mean, you know, I could use an expletive, but anyway, it's unfair, dang it. Anyway, what we want to see happen is for mainstream medicine to meaningfully incorporate chiropractic into the healthcare system. We want to see insurance companies fairly compensate the doctors of chiropractic, excellent doctors like you.
Sure. And with that, we're going to go ahead and close out this segment. Thanks again for staying tuned with us. Next, we are going to talk about some of the experiences that we've had with some MDs and some other doctors, and the referrals that can go on, and some of the really positive aspects of this whole healthcare model. But again, I'm Dr. Brad Shapiro with Ultimate Health Chiropractic, and please stay tuned for our next exciting segment. Hi, I'm Dr. Brad Shapiro with Ultimate Health Chiropractic, formerly known as Anderson Chiropractic. With me, I've got Dr. Jerry Anderson.
Yes, I'm still here.
He's still here.
Yeah, right. We're having a lot of fun.
We want to give you our disclaimer again that, please don't take anything we say as, healthcare advice for you. If you've got a healthcare condition, if you've got a situation, please seek out your own healthcare provider for their opinion, their advice, and move forward with their expertise. Remember, we can't treat you over the airwaves, so please keep that in mind. But moving forward, we want to talk about some of the referrals that we've had, some of the experiences we've had with MDs.
Wait a minute. We've never really tried treating anybody over the airwaves. Maybe. Well, forget it. It's a joke. It's a joke. Yeah, we got an interesting call a few days ago. I guess, it's turned into a few weeks at this point, but it was from an ER doctor, medical doctor, at one of the emergency rooms, not too far from here. And the guy was really nice. He's always been a great guy. And he was asking, I said, Jerry, he said, do you think that we ought to refer this guy for chiropractic? Here's the situation. I could give him the drugs. I could give him the, quote, poisons. He likes to refer to this in a very holistic fashion. But anyway, I said, yeah, from what you're describing, it sounds exactly like a chiropractic case. And Dr. Shapiro will be delighted to take a look at it. And if necessary, give me a shout. I'll get in on the case as well. But I said, I think you're making a really good call here. Thank you. He did, and it worked out beautifully.
Oh, the patient's getting a whole lot better. It's clearly a chiropractic case, and it's one of those deals where, again, when different doctors communicate, the patients really come out on top. And it's exciting to see this guy move forward with his health.
Well, this was sort of exemplary of the kind of thing that we would like to see happen a lot more often. It's where the medical doctor, he knew that chiropractic offered something. This medical doctor is a little bit unusual. He has a background in which he was in the military, and he just by the course of things, hung out with an osteopathic physician who happened to be one of those osteopaths that was big into spinal manipulation. 99% of the osteopathic community is not big into that anymore, but this doctor happened to be. And so our doctor friend really got quite an indoctrination watching what was happening, what the fellow was able to accomplish. I was really glad to see that. Mm-hmm. But at any rate, it prompted the call, and the question arises, why aren't more medical doctors referring to chiropractors? And I think back to an article that a friend of mine gave me, an excellent little magazine, Bottom Line Personal Magazine. Mm-hmm. The editor has been both a chiropractic patient and a medical patient, and she therefore can speak with some degree of authority on both worlds. She says her bottom line conclusion is the reason that medical doctors do not more often refer to chiropractors is two main reasons. Number one, they're afraid they may lose the patient, mm-hmm. because they've heard that chiropractors, they've got a lot of patient loyalty here. We
lose a customer.
Yeah. Yeah, exactly. And number two, they're genuinely concerned about their patient's welfare, and they're afraid to refer them to chiropractor because, frankly, they don't know squat about what the chiropractor really does. They don't understand the low and light force techniques, the extremely gentle nature of chiropractic adjusting, even when it's done by hand. They don't understand this, Dr. Mm-hmm. Brad, and therefore they're a little reluctant to refer. It's not that they're bad people, it's just, unfortunately, they are probably still victims of the misinformation campaign that took place, for decades, from 1924, Dr. McCullough says, all the way through the 50s, early 60s, well, up to 1970s when the Wilkes suit was filed, and the AMA really got in hot water.
Sure. One of the things I always encourage people to consider when they're worried about how safe chiropractic is just to think about what our malpractice insurance is. It is a fraction of what it is for MDs.
It is a fraction, and Dr. Brad, we always still want to be extremely careful when we treat our patients.
Sure.
And I know you're very good about this. I always did a lot of cross checks, and still do if I adjust a patient. We want to know that to the best of our ability, we're on the right track with our patient. And well, that's just sort of been my history. I just couldn't do it otherwise. I could not feel good about it myself, because I am a person who needed chiropractic desperately myself, as me, the patient. And I read an article one day in a professional magazine that said, are you the kind of doctor that you would want to go to for chiropractic care? And I thought, holy mackerel, what a real burden, you know. I mean, I've got to be the kind of doctor that I would want to go to. But anyway, when it comes to strengthening the immune system, for example, we talk about that from time to time. One of the things that we can advise people about is simply this. If you get better rest at night, you de-stress the system.
Sure.
Because you have eliminated a low-grade, chronic, worry the heck out of you, pain syndrome in the mid-back, the neck, or the low back. You've done a lot.
Sure. And kind of on that note, we've got somebody, recently we had a patient having problems sleeping. We did a combination of things with him. Number one, we did the adjustment. He had an occiput out. Occiput, for you guys that don't know, that's your skull bone. That's what your neck, that's what sits on top of your neck. So we adjusted his occiput, and then in addition to that, he got on some aromatherapy, essentially. We used some oils. He dabbed on both of his shoulders so he could get the aroma of those therapies as he slept. And the combination of those two worked beautifully. He said he slept 10 hours the other night. And like you mentioned, Doc, if you're not sleeping, you're not going to be able to repair, and you're not going to be able to heal.
Dr. Brad, after the first chiropractic adjustment I ever had with Dr. Harold Liebergazell in Camden, Tennessee, God bless him and God rest him, I went home and I slept 12 straight hours. The best night's sleep I'd ever had. Listen, and I was a kid that had gone in a few hours early and told, well, I'm not really hurting anywhere. I've just heard that you can help asthma and stuff like that. You know, I went home a different human being than the guy that walked into that man's office. I'm telling you.
You were bitten by a werewolf.
Yes, I wish you hadn't said that. You know, that's one of Will's. It's one of my favorite sayings there.
Yeah.
Yeah. The next thing is sort of like being bitten by a werewolf.
Yeah.
I go to the chiropractor. The next thing I know, I am one.
Exactly.
You know?
I noticed you had some pretty serious canines, so I knew something was going on.
But no, well, yeah.
No,
this is true.
Yeah.
Oh well.
No.
This program gets a little silly at times, doesn't it?
Exactly.
But we also have quite a bit of fun as we try to
sure.
convey a little bit of knowledge about what's going on with people, and we urge them to take very seriously the points that we make about checking out chiropractic. Oh yeah, I got to tell you about this, Joseph. This, if we can zero in on this, yes, Joseph in the amazing Technicolor Dream Coat. Yes, I'm going to be Pharaoh in this thing at Tullahoma when it appears the last couple of weekends in April. We would love to have you think about coming to see this thing. The cast is dynamite. I love these folks. They are hilarious. It's a great group of people to be working with. Go on communityplayhouse.org and check it out. So you are going to come and see it, I guess.
Oh, there's no question. I'll be there for sure.
That sounds good.
I want to see it. And thanks again for joining us on another segment of The Learning Curve. Again, I'm Dr. Brad Shapiro with Ultimate Health Chiropractic. And
that was a full moon there.
That
I
was
took
a full
picture
moon.
of the moon. Yes.
Yeah.
I was out howling and my hair was growing. No, that's a joke. But how much time we got left in this segment? We're
1 minute.
We're out of
Oh,
time.
yeah.
Okay.
Well, please join us again on our next exciting segment of The Learning Curve. Again, I'm Dr. Brad Shapiro with Ultimate Health Chiropractic. One thing I want to mention too, one thing that I'm carrying forward that Dr. Anderson started was a free consultation. If you're somebody that thinks that chiropractic might be right for you, but you're not sure, please come in and see us. If you're in the Tennessee area, we're actually in Winchester, Tennessee. We'll review your situation with you, see if it's something we can help you with. If we can, then we'll move forward, and of course there will be costs involved. If it's something you're not comfortable with, or we feel like we can't help you, or whatever the case may be, it's absolutely free. There's no hidden costs. We won't bill your insurance. We won't go behind your back and send you a statement or something random like that. Free is free. So we just encourage you to take advantage of that. But thanks again.
Thanks for watching The Learning Curve with Dr. Brad Shapiro and Dr. Jerry Anderson. Remember to consult your personal healthcare professional for care tailored to your specific healthcare needs. For chiropractic care, we invite you to consider Ultimate Health Chiropractic, formerly Anderson Chiropractic, directly across from Southern Tennessee Medical Center in Winchester, Tennessee. Call 931-967-6308 today.